Hello, and my name is Benjamin Wilke. I'm an orthopedic surgeon with OrthoEdge. I'm delighted to present to you today everything exciting that we're doing at OrthoEdge in terms of hip and knee replacement. We're doing some of the most modern types of surgeries that are done here in the Jacksonville area. I brought a few models with me today to talk specifically about hip and knee replacement. A lot of patients ask me, what is a knee replacement or what is a hip replacement? So these models will help us show. In fact, we do not remove the entire knee like many patients think. It is more of a resurfacing type of procedure. So you can see here, we have a metal component that goes on the end of the thigh bone or the end of the femur. We also have a metal component that goes on the top of the tibia. In between those is a piece of plastic that helps us balance the knee. With the help of a robot, we're able to put this in very precisely. Patients are usually able to get up and walk out of the hospital or the surgery center the same day after undergoing a total knee replacement. Similar with a hip replacement, we do not remove the entire hip. We just remove a portion of the bone. So specifically, we remove and replace the bone with a metal stem that goes inside the femur like this. It has a ball on it that replaces your femoral head, and then we put a cup just like this into the pelvis. I typically do this through a direct anterior approach, and my patients are recovering a lot faster than what they did when I used to do a posterior approach. Most of our patients are able to go out of the hospital or the surgery center again on the same day. So we're looking forward to being able to serve you. If you have any questions about hip or knee replacement, please contact us at OrthoEdge.